pigs, Glaesserella parasuis infections have varying presentations depending on the site of infection. In naive herds, we tend to see a rapid onset of disease. Animals are pyrexic and inappetent. You may see abortion and gilts. And in animals which are chronically affected, we can see lameness. Rarely, an acute septicemic disease is recognized, where we essentially get sudden death. Glasser's disease is really the classical presentation associated with Glaesserella parasuis, the one you'll read about in textbooks. And the hallmark lesion of Glasser's disease is fibrinous polyserositis, and I'll show you what that looks like in the next slide. We can also see leptomeningitis, which is inflammation of the subarachnoid space. And just like Histophilus somni in cattle, Glaesserella parasuis can play a role in porcine respiratory disease complex. So here we have our fibrinous polyserositis and pneumonia, so inflammation of multiple serosal surfaces. You can see all this fibrinous material accumulating on the surface of the organ, so it kind of has this fried egg consistency. And I think you can see that there's perhaps some consolidation within the lung, some congestion, and perhaps atelectasis. On the right, you can see fibrinous pericarditis. So again, this very thick layer of fibrinous material covering the heart. These lesions, as I understand, are oftentimes very, very pronounced. You'll see a lot of fibrin deposition on the serosal surfaces of tissues. So lots of fibrin should raise Glaesserella parasuis up on your differential list. And then finally here, we can see fibrinous polyserositis involving multiple organisms. This was in a pig that was co-infected with PRRS, so porcine reproductive and respiratory syndrome virus, perhaps just highlighting the role of polymicrobial infections, including both viruses, which can certainly be immunosuppressive, and bacteria that then set up a secondary infection. Glaesserella parasuis causes infections that are really associated with mixing herds. This is very, very important. It's an organism that really doesn't survive very well in the environment, and so it requires contact with colonized or subclinically infected individuals. The disease in pigs is typically in those about 4 to 8 weeks old, and we see a short incubation period from 1 to 5 days. Treatment relies on essentially high doses of antimicrobials early in the course of disease, if you can catch it early enough. And for control measures, we can use things like vaccination, particularly of gilts, to ensure that there's protective maternal immunity passed down to the piglets. Being careful about new introductions, so ensuring that if possible, we're bringing pigs in from specific pathogen-free herds, or at least high health herds, not mixing pigs between litters, and then also ensuring that we have adequate colostrum intake of the neonates. In people, we're very briefly going to talk about Haemophilus influenzae. This is an organism that's found in the oro and nasopharynx of about 85% of people, so it's very, very common. And just like in our animals, the clinical signs really depend on the site of infection. So fever, chills, cough, difficulty breathing. We see a wide variety of diseases from meningitis to otitis, pneumonia, pharyngitis. It can really cause a broad spectrum of clinical syndromes. This is a disease which fortunately we have vaccines available for, but before we did, it was actually the most common cause of meningitis in young kids, so from 1 month to 2 years old. And among these infections, there was a 3 to 6% case fatality rate, so very, very serious. Of those people who had Haemophilus influenza infections and then recovered, hearing loss was frequently seen, so in up to about 20% of patients. Fortunately, like I said, we have vaccines, so this is really a great protective measure that's available. Unvaccinated children are most at risk, so you need to be aware of places like schools and daycares where we have mixing. Fortunately, the incidence has decreased 99% in North America just since the late 1980s. So really, really successful. On the right here, we can see vasculitis associated with Haemophilus. So Haemophilus, remember it's in the name, it affects the blood and blood vessels. So I mentioned this organism not only because it's sort of an interesting case study in infectious disease, but also because we have some really common themes between Haemophilus influenza and people and Histophilus and Glaesserella in our pigs and cattle. So it colonizes the upper respiratory tract, It causes multisystemic disease, and it oftentimes occurs when we have mixing of susceptible populations. So I think there's some valuable lessons to be learned, and we can perhaps get a better understanding of the pathogenesis of our veterinary pathogens by learning more about human infectious disease as well. Samples to collect, specimens from affected tissues. So joints, CSF, heart, blood, or any tissues that you can find lesions on. With Histophilus and Glaesserella, you need to be aware of contamination. This is a part of the normal microbiome, and so you want to make sure that you aren't simply detecting colonized animals. Positive cultures may reflect carriage. These organisms are delicate, and so you need to collect your samples quickly and send them off to the lab as fast as possible, ideally within about 24 hours. This is another set of genera that you really want to be careful not to freeze. You're greatly going to reduce the recovery rate of the organism if they get frozen down to -20. Culture is certainly possible. We can use chocolate agar. These organisms are both readily identifiable biochemically, based on the cellular and colony morphology, and MALDI-TOF is also very useful. We have PCR-based assays, serological testing, and histological visualization to see the organisms associated with the lesions in situ. So not a group of organisms that we really struggle to isolate and identify. Zoonotic and interspecies transmission is not a big concern with either Haemophilus somni or Glaesserella parasuis. These organisms tend to be quite host-specific, and so not only are they not major zoonoses, they're also not things that we generally think of as transmitting terribly easily between animals. Antimicrobials used early in infection can be very helpful. Macrolide-type drugs specifically, so things like erythromycin, perhaps tylosin, telmicin, tulathromycin, depending on the species you're dealing with. Vaccines are also really important for Glaesserella parasuis. This is a typo. It should be Glaesserella, not Haemophilus. Haemophilus species do not generally produce beta-lactamases. We know this from human infectious diseases. And so when dealing with Histophilus or Glaesserella, beta-lactamase inhibitors are therefore not likely to be helpful in beta-lactam-resistant isolates. So if you have ampicillin resistance or amoxicillin resistance, amox plus clavulanic acid will not be helpful. We also know that we see intrinsic resistance among these organisms to the streptogramins. So particularly in a porcine context, drugs like virginiamycin are unlikely to be useful. Have a few new terms for today, and then of course, some questions for self-assessment.